And welcome back. Working out more and eating better, they're two of the most common New Year's resolutions. And while they may be good steps to take, there is more to your health than just diet and exercise. Here to help us lay out a path to healthy living in 2026 is Church Health Community Engagement Director Randy Kostick. Randy, welcome back. Glad to have you here. Good to see you as always. Let's talk about this Church Health Center model for healthy living. It's been said this model is for the whole person. What do we mean by that?
So Happy New Year coming up, everybody. It is my favorite health promotion model because it addresses all aspects of our lives.
Okay.
It's not exercise and nutrition are important, and they're very tangible aspects to our health and wellness, but there's other components that are very important. As somebody who's thinking about maybe changing up, making some positive changes, moving into the new year, do you consider faith as an area that you want to improve? Do you take your emotions into context when you're trying to make areas of improvement? Family and friends, work, how do you attach all these different pieces of the puzzle?
As I listen to you, Randy, is this about almost connecting the dots, so to speak, between faith, medicine, friends, and families, and everything else?
Absolutely. As an educational tool, first and foremost, it gives us information of what these different components do. But the secondary part is how they interact with each other. So for example, you have a bad day at work. How does that impact your family when you get home? Or what can you do to impact your day at work so you don't necessarily bring that negativity home? Exercise would be a great option. Taking a deep breath, evaluating what your communication styles were at work, that you can make an adjustment, that you can adjust and have a better day at work. So there's all these different pieces of the puzzles that work together all throughout the day, all throughout our lives. It's constant give and take.
Pieces of a puzzle that need to connect these days. Also, as you paint this picture for us, help us kind of look at this physically from maybe using a primary physician, an eye doctor, a health coach, etc. Trying to make sure we can attach to those.
Yeah, so that's the medical aspect of the model for healthy living. And basically it's all about building a partnership with the medical system. All of us are going to be involved in the medical system at some level at some point. Even if you're just getting your blood pressure checked while you're waiting in line at the pharmacy or at the store. That is an interaction with some level of the medical system, depending on what feedback you get from that tool that you use to learn something about yourself will dictate different steps. But the education, the relationship, and of course, building a relationship with a medical provider is very important, because the better relationship you have, the better communication you can have about yourself and what needs it.
Something a lot of us don't always think about, but we should.
It's an area that I have not done great in on my own goal setting.
I know what you mean for sure about myself.
Provider, yeah.
What's also cool about this is you also have a partnership with the YMCA of the Mid-South. How does that kind of work?
Yeah, great point. They're wonderful. And they mirror Church Health in so many different ways as far as the family, the holistic aspects. Their focus typically is a little bit more on movement directly, just like ours is. Focused a little bit more on the medical aspect, but all these pieces come in play. I mean, the simple reminder on how great you feel after you do some exercise.
It can be a good feeling.
It's an immediate positive feedback.
You have accomplished something as well.
That's right.
One last thing though, as we try to really accomplish these goals, especially in the new year, how much of a challenge is this though when it comes to like dealing with the Affordable Care Act and subsidies and the future and how those are in jeopardy these days?
So on that aspect, the first thing that comes to mind is educating yourself on what resources you have available. Of course, Church Health can be a resource for that. Where you're at with your medical provider, if you don't have a medical provider, and planning for your needs. So goal setting would start in the medical area with setting a goal, and again, let's keep it as simple as possible, of getting some information on what is going to happen to your current coverage and how that's going to impact you, and start planning and then asking questions.
Yeah. We all want to be healthy in 2026. Randy, always good to see you.
Thank you.
Come on back anytime. We'll be doing this quite often, I hope, in the new year.
Yep.